the follow-up appointment from my ectopic surgery that I got 2 weeks ago. Um, and I'm just basically getting ready. My appointment is later on this afternoon. So just kind of straightening things up a little bit because hello, it's a mess in here. I actually did not use all of my pain medicine. Like I probably took it. It was the pain medicine they prescribed me after my surgery, and I probably took. I think I used it maybe for 3 to 4 nights. So I only took about 3 or 4. I think I took about 4 of them. Um, and yeah, that just was only at nighttime when it was time for me to go to sleep, so I could easily get comfortable and be able to sleep throughout the night without experiencing any pain or whatever. And that's really the only time no, that is the only time I took it. I didn't use it for anything else because I didn't go anywhere. Didn't need to go anywhere. One, because hello, pandemic, but two, um, they told us, as in my husband and I, for me to stay off my feet for a while, well, for like the 2 weeks that I'm recovering. So there was no need for me to go anywhere and do anything. So I felt like being in the house, as long as I was comfortable in the bed or comfortable on the couch, I would be fine. And I was right. So I live in a county where it is mandatory for us to wear masks when we go out. And my mother in law got my husband and I some reusable masks or whatever. So I just want to kind of test this out because I haven't tried it on yet. And um, and that's because when she gave it to us, what, yesterday or the day before yesterday, I think it was the day before yesterday. We washed them first, obviously, and then so I didn't get a chance to try it on. So it's like I have to try this on to determine how I'm gonna do my makeup today. Cause it's like, should I do a whole face or should I just do powder? I don't know. So I just want to know how much this touches and rubs on my face because I wear makeup and this is really, yeah, weird. Well, it sucks because it's gonna be makeup all over this, y'all. Like I can't go out looking like this. I look crazy. So here goes nothing. Okay, so we're headed out now, and it's gonna take us about 45 minutes to get down there. I tried to match up as much as I possibly could with my mask and my shade. You see what I'm working with? I don't know how well I did, but believe it or not, this is the only blue that I actually have besides like blue jeans and a white shirt. But yeah, and I say believe it or not because blue is my favorite color. How did that happen? I don't even know. Anyway, yeah, so we're just gonna ride now, and hopefully I'll be able to record during my appointment. I'm gonna ask for permission first. If she said yes, then you guys will be there with me. If not, then I'll just have to tell you what she said when we're done. Okay, guys. Hey. So right now I'm just waiting for the doctor to come in. I'm gonna ask her permission to record, and if she says yes, then we'll record. If not, I'll just talk to you guys afterward. But just waiting. The nurse came and already took my blood pressure, so just kind of hanging out. And it is 3:47, so my appointment was at 3:45. We got back here a little early. We did the weigh check-in and all of that, so we're good to go. Everybody has masks in here. There are no husbands, no boyfriends, no companions whatsoever in here. Just the women that have appointments. So that's just the way things are right now. Everyone's wearing masks. No one's taking them off to have a conversation. That's what I'm experiencing so far. So I don't want to take mine off and be all weird because, it's the law out here. We travel from my county to 45 minutes away, which is a completely different county here in Palm Springs, but it is mandatory to wear masks out here as well. So, yep, we're just hanging out with our masks on. It's kind of hard to, like, have a conversation and emote well because this is in the way, but yeah, I think I'm getting used to it. Okay. The camera's right there, so you're behind.
Oh, that's a camera. I'm like, what is that? Anyway, how have you been?
I've been fine. I've been pretty good.
How long since your surgery now?
2 weeks.
2 weeks exactly. And did you have any problems after your surgery? Any problems with fever, chills, nausea, shortness of breath, chest pain? Anything weird or abnormal?
Nope.
Pain-wise, how many days of pain?
Pain. Okay, so how I described the pain was more like muscle soreness than anything. That was the most pain that I really experienced. Down here, it did kind of feel a little sore for a couple of days, but I only used the pain medicine, I would say about 4 times just to go to sleep at night so that I can find a comfortable spot easier and just sleep throughout the night. But the only time that I actually really experienced any pain for real was like that first week getting up to use the bathroom and if I try to walk too fast or something like that.
Right. Did you get any pain in your shoulder area?
My neck and stuff, yeah.
Yeah, that's usually that gas that sort of bubbles up there. That's sort of weird.
Yeah, that's exactly what it felt like.
Yeah, exactly. What's your activity level currently?
Now I'm able to just get up at my leisure. I don't need help. But I haven't been picking anything up. I did fill a pellet stove, but I just used a bowl to scoop.
Okay.
But that's about it. Nothing major.
Good deal. Good. And bowel movements. Any issues with your bowel movements?
No. Before all of this, I always had issues, but I've been taking Citracel and doing Activia yogurts twice a day. So ever since I've been doing that, it's been pretty regular.
Yeah. Any issues with your urine?
No.
Okay. I have the pathology from your surgery. So this is for you. You can keep that with your records, and it was an ectopic pregnancy. So all that just confirms that. Okay. And it was on the left side. Other than that, the findings of your procedure were of a normal uterus and normal liver and gallbladder. But your other fallopian tube looked normal. So I'm hoping that your other fallopian tube is open and that there's no problems with the inside. When I look laparoscopically at your fallopian tube, I can only see the outside of the tube. So I don't know what the inside is like or the misinformation on the inside. And at the moment, are you doing any birth control?
No. I've just been taking prenatal.
Are you planning a pregnancy again soon?
Yes.
So just give your body maybe a couple months to recover.
Okay. And if I were to, get pregnant before the 2 months, would that be dangerous?
I mean, obviously you had surgery, so the ideal is for you to allow your body to recover well from surgery before going into another pregnancy.
I'm not trying to. I just want to know. Just
right. And the main thing is after you get pregnant, your abdomen starts expanding. So those incisions, if they haven't healed completely, then you can just have a little bit of trouble with that. So that's why we just want to make sure that there's complete healing of your incisions before you get into a pregnancy, that's gonna make your belly grow again.
Okay.
Now, one question, and this is, up to you 100% whether you want to go through with this test or not, because you have now 1 fallopian tube left. You have the option that we can send you for a test to test whether that other fallopian tube is open.
Okay.
It's a double-edged sword because, obviously at the moment you can just try to get pregnant and, you have a great likelihood that the pregnancy will be perfect and all will be good. You still have that likelihood that you could have another ectopic pregnancy. Okay. If we do the test, great. If it's all clear and your tube is wonderful and beautiful, it's wonderful and it'll be very good. But if it says that your tube is blocked, then it would mean that you wouldn't be able to get pregnant ever. So it's like one of those things that do we just see what happens with you trying to get pregnant on your own versus, do we get all the information that we can before you try another pregnancy? And again, there is no right or wrong to this. It's just sort of, like where you feel your comfort level would be and how much information you want to have before you attempt another pregnancy.
Okay. Well, the question would be, what would that test entail?
That test entails going to like one of the imaging centers, usually like Desert Advanced Imaging.
Mm-hmm.
It's timed based on when your period is going to come.
Mm-hmm.
So they typically have you call like the day your period starts, and then they let you know what day you come based on that. Then when you're there, they put a speculum in the vagina, and they look at your cervix, and they put a little tube inside of the cervix, and they put dye inside of that tube.
Okay.
And then they look and see with X-ray if the dye is going through the fallopian tube and spilling inside of your belly or not.
Okay. Well, that doesn't sound terrible.
It's not terrible. It's a little uncomfortable, but it's not terrible.
Okay. All right. Then I do want to do it.
Okay. And you're able to do that at any point, so you don't have to wait. Like you want to call with your next period and then schedule based on that.
Okay. Okay.
So I'll give you an order for that, and once you get pregnant again, we want to see you back. Hopefully this time put it in the right place.
Hopefully, that's what I'm hoping for too.
Do you have questions about anything?
No. I just came off my period on Sunday, so that would have been my question, but since it showed up on its own and went away,
Good.
it was pretty normal. Yeah.
And in the meantime, just condoms for birth control, or what are you using?
Well, my husband and I haven't been using birth control prior to this, so, and we haven't had sex because you said no sex for 2 weeks, so we haven't been doing that.
Good girl. Good girl.
Not to mention, I was a little afraid.
Mm-hmm.
So, at the moment, he's talking about just pulling out, but I guess condoms are probably the best.
The safest thing would be to use the condoms because the pull-up method is not a very effective method. If you want, we could also do, a month of birth control if you want, but it takes either way, like a few days for the birth control to become effective, so you'd still have to use some backup protection for the first couple of weeks. If you were to do birth control for a month or 2 months, well, it's, so if you don't think he's going to use condoms.
We can do that. I'm good with birth control.
Alrighty, we'll do that.